Welcome back to Now Media's TV show, Pain Diaries, and I'm Dr. Suzanne Manzi, co-owner of Performance Pain and Sports Medicine in Houston, Texas. Today I'm going to talk to you all about the different types of joint injections. Whether you're a weekend warrior, nursing an injury, or an arthritic patient seeking solace from relentless joint pain, a common treatment option you might have come across is joint injections. Steroids, being a prominent component, often raise eyebrows and concerns. So here we're going to cover every detail you need to know about all the different joint injections and the role steroids play in managing your discomfort, along with other types of injections as well. So first of all, what are joint injections? Joint injections are also known as interarticular injections and are an established method for temporary relief of joint pain and inflammation. These injections can consist of various substances, with corticosteroids being the most widely used. They're designed to mimic the effects of hormones your body naturally produces. Steroids and joint injections can ease pain, reduce swelling, and improve joint function. Steroids play a pivotal role in joint injections, acting like a supercharged version of your body's own anti-inflammatory compounds. They bring down the inflammation quickly and effectively, and steroids can offer you a ticket out of the chronic cycle of pain and inflammation, allowing the body a change to kickstart its own healing mechanisms. Local anesthetic is the secret ingredient that makes pain relief in joint injections so effective. But what exactly is it? Well, it's a type of medication that causes temporary loss of sensation in a specific area. It's like flipping the switch off when on your pain receptors. So usually when injecting steroids, local anesthetic is added to the mixture that is injected. It's like a 1-2 punch to your joint pain. The local anesthetic provides immediate relief, while the steroid works over time to reduce the inflammation. So our bodies are engineering marvels, and the joint is one such masterpiece. It's where the two bones meet, held together by soft tissues called ligaments. To ensure smooth movement and cushioning, the joint space is filled with synovial fluid, a thick, stringy liquid that reduces friction. Over time, age or injuries can wear away at this protective barrier, leading to painful conditions like osteoarthritis. But what if we could replenish this fluid, like oiling a rusty hinge? Enter hyaluronic acid. So let's strip away the medical jargon and simplify the process. In essence, a joint injection involves introducing a needle into the affected joint and delivering medication directly where it's needed. The procedure is usually quick and performed in a medical office with local anesthesia to minimize discomfort. The area to be treated is sterilized, and then local anesthetic is administered over the skin using a small needle. Performance Pain and Sports Medicine prides itself on administering joint injections with image guidance, meaning we utilize either X-ray or ultrasound to ensure the medication is actually delivered into the joint, unlike in this video. Once we have the target aligned, the medication is administered and the needle is withdrawn. A bandage is applied, and then the healing can begin. After the injection, it's important to rest the joint and avoid strenuous activities for a day or two. It's like giving your joint a mini vacation, allowing the medication to really work its magic. So how effective are joint injections? Well, this depends on what we actually inject. Steroids can bring significant relief, especially in the initial stages post-injection. Some patients report pain relief in just a few days, while for others it may take a week or two. The duration of relief varies greatly, with some patients experiencing pain relief for weeks and even months. So what is hyaluronic acid or gel? It's often hailed as nature's moisturizer. Hyaluronic acid, also abbreviated as HA, is a type of sugar naturally produced by our bodies. Its ability to retain water makes it an essential component of our skin, eyes, and most importantly, for our discussion, joints. As a major ingredient of synovial fluid, HA acts as a lubricant and shock absorber. In the late 20th century, scientists had a light bulb moment. They proposed injecting HA directly into the joint space to alleviate symptoms of the degenerative joint conditions. Thus, the concept of joint injections, also known as viscosupplementation, was born. These injections aim to replenish the depleting hyaluronic acid levels in your joints, essentially acting as a liquid cushion. This leads to reduced friction and pain. Despite the potential benefit, joint injections are not without their risks. So possible side effects include infection, allergic reactions, temporary increase in pain, but these risks are usually generally low. It's important to have a comprehensive discussion with your doctor before proceeding with this form of treatment. So who should consider joint injections? Joint injections can be a viable option for many patients, particularly those with inflammatory joint conditions like rheumatoid arthritis or degenerative joint disease, also known as osteoarthritis, and those people with persistent pain despite conventional treatments. Your doctor will determine your suitability based on a variety of factors, including your overall health, the severity of your condition, and your individual response to medication. A joint injection can be the best option when other treatments aren't working or when quick and effective pain relief is needed. It's like calling in the special forces when the regular troops aren't enough. Corticosteroids like prednisone, methylprednisolone, and triamcinolone are commonly used in joint injections. There are also many different types of anesthetic agents that can be used, such as lidocaine, bupivacaine, and ropivacaine. Each has its pros and cons, and the choice of steroid and anesthetic often depends on the individual patient's need and the physician's experience. There are also over 15 hyaluronic acid products on the market, and options are endless. And as I discussed, steroids aren't the only show in town. Other therapeutic options, such as hyaluronic acid injections, injections with regenerative medicine in conjunction with physical therapy and an anti-inflammatory diet, and certain medications might also provide relief for some patients. The best approach often involves a combination of treatments tailored to each individual. So after a joint injection, some patients may experience a flare of joint pain that lasts for a day or two. Applying ice pack to the affected area can help ease this discomfort. Long-term management includes regular checkups to monitor your condition and adjust treatments as necessary. So let's jump into some frequently asked questions about joint injections. How long does it take for joint injections to work? So joint injections can start working within a few days, but it might take up to 2 weeks for full effect for the individual to really notice it. Is the procedure painful? Most patients describe a sensation of pressure rather than pain during the procedure. Use of local anesthesia or sometimes a topical anesthetic and modern medical techniques make the procedure relatively comfortable. Are there any side effects to be aware of? Like I said earlier, while joint injections are generally safe, potential side effects may include bleeding, local skin reactions, infection, allergic reactions, and sometimes a temporary increase in joint pain. Who should consider joint injections? Those with inflammatory joint conditions, arthritis, or persistent joint pain unresponsive to other treatments may benefit from joint injections. However, this decision should always be made in consultation with your doctor. What type of steroids are used in these injections? Usually we can use prednisone, methylprednisolone, or triamcinolone, which you might know as Kenalog or Depomedrol. Can I get the injection more than once? Yes, you can have the injections more than once if needed. It's like a refill for your pain relief. Also, certain hyaluronic joint injections come as a series, so some are a single shot and then some come in a series of 3 and 5. Insurance usually covers these injections every 6 months, whereas steroid injections mixed with anesthetic are usually approved every 3 months. Is it covered by insurance? Well, coverage for joint injections varies by insurance plan. It's best to check with your insurance provider, and when we at Performance assess your need for an injection, we submit for approval to see the coverage benefits. Injections utilizing regenerative medicine are currently considered experimental by insurance companies. Will I be able to resume normal activities right away? Well, you should avoid strenuous activities for a day or two after the procedure. Think of it as some downtime for your joint. Utilizing regenerative medicine, this will vary as a healing process needs to take place, and high-impact activities are highly discouraged. So now I want to shift and talk about regenerative medicine, which includes platelet-rich plasma and bone marrow concentrate aspirate, BMAC, injections into the joints. I believe this is the future of treating joint pain. With ongoing research, the scope of PRP in medicine is expanding like a mushroom cloud. While it's predominantly used in orthopedics right now, its use is spreading to other fields like dermatology, sexual health, and dentistry. The sky's the limit when it comes to the future of PRP in regenerative medicine. First off, the patient's blood is drawn from the arm and then spun down, separating the cells, removing the red blood cells, and leaving the platelet-rich plasma, or PRP, which contains the growth factors. This is then injected directly into the joint to promote healing. The BMAC joint injection procedure involves 2 steps. First, bone marrow is harvested typically from the back of the hip under image guidance. The collected marrow is then processed in a centrifuge and spun down, which separates and concentrates the regenerative cells. The resulting mixture, known as BMAC, is then injected into the troubled joint, again under image guidance, to ensure the cells are placed exactly where they need it. BMAC joint injections work due to the powerful regenerative properties of bone marrow. Bone marrow is rich in stem cells, the body's raw material for creating new cells. And when concentrated and injected into a joint, these stem cells supposedly trigger a healing response, facilitating the repair of damaged tissues. The benefits of BMAC joint injections extend beyond simple pain relief by harnessing the body's innate healing mechanisms. BMAC joint injections can potentially restore damaged tissue, improve joint functionality, and even slow down or reverse the degenerative changes associated with osteoarthritis. These treatments are minimally invasive, utilizes the body's own materials, and offers the potential for tissue repair, not just symptom management. So in conclusion, joint injections with steroids, anesthetics, and hyaluronic acid included can be a valuable tool in the arsenal against joint pain. Joint injections, and specifically PRP, are changing the way we manage joint pains. BMAC joint injections are revolutionary in a procedure that harnesses the body's natural healing abilities to treat joint pain and degenerative joint disease with its potential benefits and minimal side effects. It's an exciting addition to the repertoire of treatments available to individuals suffering from any joint pain. As with any treatment, thorough research and consultation with a doctor well-versed in these procedures are essential. So feel free to reach out to us at Performance Pain and Sports Medicine and schedule your consultation today. 346-217-1111. What a great episode, and thank you to our amazing guests today for being a part of the show. Remember, I'm Dr. Suzanne Manzi, physician owner of Performance Pain and Sports Medicine, and my partner is Dr. Matt Wiederholtz. We can all be found at 4126 Southwest Freeway, Suite 1700 at Performance Pain and Sports Medicine, located in the T-Mobile Tower on the feeder of Highway 59 in Houston, Texas. I can be found in Main Street in League City, Texas, and we are happy to discuss any of these options and treatments featured on this show, as we incorporate all of these based on a patient's individual need. So don't forget, subscribe to YouTube, to my Pain Diaries, Dr. Manzi, and catch all my shorts and episodes, bringing you all things pain-related and educational. Information on the newest and best technologies out there to make your life better. Remember, this is Pain Diaries, so take care of you so you can take care of business.